good evening or good afternoon or happy Thursday, whichever applies. I'm here today, coming back from 7 to 3. I actually survived one more day, and I will call it a week. I am so done. I'm tired of getting up early. That's not my thing. Anyway, this is why I'm here. I'm interested in the news that is circulating around. I hear that companies threaten to terminate employees who refuse the COVID-19 vaccines. Even healthcare workers are also in the crew. So this is my thing. Companies that pay their employees good benefits and good salary can afford to do that. Some of healthcare facilities can also afford, because they are in neighborhoods where they are really working and managing business as a private business. Their money does not necessarily all come from Medicare or charity or whichever you name it, but there are facilities that are regular facilities that have to receive some kind of funds from Medicare, and those are facilities that cannot really afford to terminate employees who refuse the COVID-19 vaccine. I love what I do, and many people are in the same place. In this call, we responded to a call. We take care of very sick people. We take care of all kinds of people that need our services. We enjoy that. But we deal with other things that are not those patients when we go to these jobs. First of all, if you did not know, many of us in healthcare don't actually have real benefits. What I'm talking about is a pension plan or a reasonable a contribution by an employer to an employee's pension plan. This is what you will hear. When you get a full-time job in healthcare, you will be told that we have a 401k or a 403b or a 457 plan or a pension plan. Most companies that offer these first three plans, the 401k, 403b, and 457 plan, do their contribution after a year of service most of the time. What percentage are they offering? This is the most interesting piece. It's either 2.5% contribution for every $100 an employee earns. That makes it $2.50. Let's say an employee works for that company for 40 years, retires at 67 and a half, whereas getting a 2.5% contribution for 40 years, how much of that 2.5% contribution can help that person sustain her life? Because when we reach a certain age, or when we come through life at different stages of our lives, we physiologically decline. Therefore, some of us will need healthcare services, medication, many doctors to see, and we will need to have our own mini pharmaceutical industry in the kitchen, and that has to be paid for. And that's what I'm talking about. There is no pension plan out there. And then if you work for a company that offers a retirement plan that is called pension now, this one is even worse. These companies are usually local governments. Any employee working for them must work for 5 years to get 100% contribution, to add it to the 9% contribution they will be paying into for 5 years. Let's say you get hired, you work 4.5 years, then you get terminated 6 months away from that 5 years. You are not going to get any 100% contribution. You walk away with just what you put in, and that's what happens to us. Many of us don't have any unions. Now, we take care of sick patients, okay? We are healthcare workers, but we cannot afford our own healthcare. These facilities tell us we are providing 50% of your healthcare costs, you pay 50% of your healthcare cost. So some of us have to pay $110 or $150 every 2 weeks for our own healthcare. And then when we go to the hospital in the emergency room, whatever healthcare plan we picked, we get there, we find that we have to pay an additional $100 fee in the emergency room, because it's an emergency room fee. When we go to get the labs done, we have to pay a certain fee. So there is a fee for us for everything we go for healthcare for. If you add a child or a husband, your contribution is going higher. The employer is only going to pay 50% towards your own, and not your child and not your spouse. So you may be looking at losing 10% of the income towards healthcare, and then at 25% and higher paying the US government, the state, the city, all of them combined. Some of us are in a 30% contribution on our annual taxes. This is why we are so angry, because after all that, now we're talking about 35% healthcare and taxes contribution. But what are we putting in for our own 401k? We don't have anything left to do. We don't have enough, because we still have to pay for mortgage, school, tuition. We have to pay for childcare, groceries, utilities. So we end up putting just the basic percentage that the employer is going to contribute. Therefore, we end up putting $2.50 every $100 we earn. So you hear people say, nurses, she was a nurse for such and such a long time. Those nurses, you see them in a nursing home sharing a four-bed room with other patients who never went to school, never did anything, who never worked. They qualify for welfare, and that nurse now is in a nursing home in the same room, divided by a curtain. That's us. What else? Vacation time. Here's another one. When you are told you're going to get 10 days of vacation after a year of service, this is what you're going to hear, right? You're getting at the door, 10 days of vacation after a year of service. Now you fall sick in 9 months, you call out sick, you end up staying home for 2 days, you get the next paycheck. It shows that you got paid for irregular hours, as if you worked those 2 days you called out sick. Now it's time to go for a vacation. You planned your trip, you paid your ticket, you go to the scheduling and ask for time off. And then the scheduling tells you your vacation is 16 hours less, because the last time you were sick, you called out on this date, on that date, you were paid 2 days out of your vacation time, because you do not have sick time separated from vacation time. This is one secret some facilities will not tell you. And on top of that, getting a vacation approved goes by seniority and healthcare staffing. If we need you for this weekend, we're going to give you 3 days of vacation on this week, Monday to Wednesday. You have to come back on Thursday, Friday, Saturday, because we cannot afford to work short. And then you cannot take time off and take a vacation by December 15 up to January 15, because we want to have enough staffing during Christmas season. So your patients have access to Christmas and holidays. They can be in their homes, their families come in, they cook, they bring whatever they can bring on the floor, but you have to be at work. You can't go home, you can't take time off. You don't have Christmas because you are a healthcare worker. And these are things that we deal with. This is the kind of aggravation I'm talking about. Last but not least, we have to be working short. Almost 70% of the time we are working with short staffing. CNAs know this, and they can tell the truth. If they were to be on Oprah Winfrey, the whole country can testify on this, because these CNAs are always doing 1.5 person's work for 1 person's income. They get injured, they get assaulted, they break their backs, they lift weights, American weights. If you know American weights, they lift American weights that are impossible every day that they are on the clock. They smell all kinds of human secretions, including us nurses. And when do we see full staffing? When the state surveyors are in the facilities. The DON, the administrator, Everything in administration, corporate, everyone calls each other and everyone shows up. Even if the administrator was in Las Vegas, the day they hear that the state surveyor is in the building, they will show up. They will show up. This is why we are so angry. We are not slaves. We went to healthcare for the love of taking care of patients, but we're not going to volunteer with our own piece of blood. No, we are not donors. We're not going to give away what we value. If we refuse the vaccine, that's that. It should be accepted. If these facilities don't want to keep us, fine. We have agencies. They are paying us high good income. We can travel and work anywhere. We're trained to work anywhere and deal with all kinds of nonsense. But we're not going to take nonsense from facilities that don't give us anything back. No, that is a no, and that needs to be understood.